What's up, Guru Nation? Let's demystify clinical research.
Guru Nation, thank you so much for watching. Make sure you like, subscribe, comment, share. If you're listening, thank you as well. I'm here with Judy Galindo. So she's someone that I've gotten to know over the years. You know, Judy, and by the way, her LinkedIn is underneath this video. Go connect, go follow her. You have to. It's an absolute must that you connect with Judy. 18 years in this industry. So did you know I knew of your site before I knew about you?
Really? And how?
Yep.
How did you find
Because at my site way back in the day in Anaheim, not too far from here, this was like 07, 08, I was doing a study with neurocrine on tardive dyskinesia. And our monitor, Evie, she said, because I talked to her about, this weekend, what are you doing? I'm going to Yuma. My wife's from there. We're going to go visit. And she said, then you pass by and you must know Sun Valley Research Center. And I said, no, I don't. Never heard. There's a site out there? And she said, yeah, there's a site out there and they do pretty good. And I drive out there when I need to. And then, so I knew of your site. So I knew someone was out there.
Right.
And then over the years, I think because of YouTube, you reached out to me and then we started connecting. But you inspired me to that. You showed me it's possible to do Yuma clinical trials because the seed was planted already. Like, wow, I never thought they can do research in a place like that. I guess, where do they fly into?
Right.
And it kind of laid the foundation. Like, well, it'd be nice one day to have a site in Yuma. I never thought I would live there.
Right.
So I knew of your site before you.
Oh, that's funny.
Yeah. I just thought of it yesterday. I'm like, how did I? Because they asked here, how do you know Judy? I'm like, it's a good question.
Yeah.
So I knew of your site before you. So your reputation preceded you from the site.
Well, I'm glad it was positive. You know, we do our best. So
how did you start with that site?
So it was like 16, 17 years ago. I worked for a sleep disorders clinic in San Diego, and there was a sleep doctor that has his office in El Centro. And so what they did is they tried to open a research center with that doctor in El Centro. And I would volunteer to go and, help out, train the staff. And I think it maybe existed for a few years. It didn't really work out. One of the sub-Is they contracted with is my current PI, Dr. Inc.
So that planted the seed for you to do it out there.
Exactly. And so
then you planted for me.
Right. So then when I wanted to move on from the company, I actually did apply to go be a monitor. I don't remember the company. It might have been PPD.
Monitor?
Yeah, I was thinking about that was my next step because I think I had gone from
You had a bachelor's?
Yeah. I went from being a research assistant, starting at the very bottom, to helping establish a call center, to being a research assistant to the coordinators.
Where'd you get your bachelor's?
From San Diego State.
So you're from San Diego?
Yeah, San Diego. That's where.
Born and raised?
No, I mean, I moved there as a baby, and that's where I grew up. And so that I moved up, I would say, to like a manager in training. And so I was ready to move on. And the next thing was like, well, logical, right? You go and be a monitor after you've been at the site level.
Yeah.
But then when I applied, I realized like, I don't know if I want to jump into that. Like, travel. I was single, I think, at that time, or I had just finished college. So I would have been able to go anywhere, right? And work anywhere. But then I was like, no, I think I still want to like do something at the site level. And then this opportunity came. I connected with the sub-I at that time, Dr. Ng. I told him I was moving on. I actually asked him for a letter of recommendation, and he's like, nope, come down, visit me. I want to start a site. And that was the rest is history.
So he basically kind of handpicked you.
Yeah. With another investigator at that time that we had. And they were like, we want to start a site. He's always had some experience in research. He had kind of worked on research studies, but not an official research center.
What do you think he saw in you that made him?
We worked well. So when he was a sub-I for the other company and he saw me go down there and try to help the staff, we just, we clicked, we worked well. He saw that I was, a hard worker. I was willing to do what we needed to, a team player to make it successful, even though it didn't work out with that office. And I think he saw that probably that was opportunity, that person he needed to get his vision of starting a site off the ground probably. And it worked out because we do work well together. And that was 16, 17 years ago that we started with, he had an office, he had space, but there was no center. And just over the years.
And he had a private practice.
Exactly.
He was setting it up.
Right. He already had it.
Oh, he
So it
already
was-
had it. So he lived out there in Imperial.
Yeah, he had the space, he had the building, and so it was easier to set up a site because he already was established.
And
as
the same one I visited?
Yeah, same
Okay.
one. So, but the other site you had visited was in a sense empty,
Yeah.
and then over the years we kind of like developed it and then
Okay.
expanded into other parts.
So he owns that
the whole
property.
building.
Okay.
Yeah.
Did you ever live out there?
No, since I've always commuted, even with the prior company.
Was it ever like every day?
No, it was always like a few times a week, or this was before I had kids. I would actually just go and stay like 3 nights. You know, I would do Tuesday and Thursday and just kind of make the most of it and then come back to San Diego.
So when you guys started, were you like the only coordinator?
Yeah. So it started with investigators, myself, and then we actually took, we brought on one of the staff he had in the front office who was kind of interested in research. So we kind of like brought her over and started training her. She's still there.
So you trained her?
Yeah. Yeah, she's
And
still
there.
She's still there to this day, and so we did. And
Did
then
I
from
meet
there,
her?
Rosie Sanchez,
okay.
yeah. So she's been there, and then from there we just
Wow.
added staff over the years, and but we've had to train everyone from the beginning. There's nobody with research experience. You know this, Numa.
Well, that's what me and you are doing the training panel.
Exactly. So it's from the bottom up. We have to, introduce them what is clinical research, all the different things they need to know. It's a lot of work to get someone trained to.
A lot.
Even a research assistant takes months to get them trained. So imagine a coordinator. And we're still having to do that. So I'm very thankful now that we have all these other resources because back then it was a lot harder to do.
Yeah, it was a lot harder. And you and I talked about, how many employees do you think came through your clinic?
So right now we probably have about 10. We started with myself that many years ago. In between, we've had like research assistants, pre-screener recruiters, some coordinators, marketing outreach people that kind of like came and went or moved on or moved out of the town or went to pursue like their education in other areas. But for the most part, I've had several who have been there with me for several years.
Okay. Because we started around the same time. I started my site in 2005, but you've stayed in the same site.
Right.
This whole time.
And it's taken a while to grow to where we're at. I think like growing pains with any site, right? And when I jumped from being, I guess, kind of like a research manager and trained to being a site owner, there was a lot of things I didn't really know. So it took a while to like learn all those things, contracts, budgets, a lot of
you have to learn
stuff,
all that on
right?
your own.
I wasn't exposed to that previously at my other job. I just knew the coordinator aspect, maybe some of the management aspect, but I knew a little bit about what it took to open a business, but then the other rest of research I kind of had to learn.
And Chris, we're over here prepping for our Save Our Sites conference, saveoursites.com. He says you're the most fiercest negotiator on contracts.
I think because I ask for a lot, and I ask for a lot for a specific reason. Because working in Imperial County, doing what we do, trying to recruit patients, it requires a lot. We're in the community. We do a lot of outreach. We advertise. We go to health fairs. It requires a staff of people to do this.
But every site can say that, though.
Right. But we're actually doing it. And so we're actually doing, but it is a lot more work, a lot of time, a lot of cost to do this. So I do request certain things for the studies that we're working on. And then on top of it, we get this criteria on the protocols that they literally want the most ideal patient for who has a condition like depression, and we're excluding a majority of the patients who have depression. So then it takes even more work to find the ideal patient. And sponsor CROs need to pay for that. Like they want us to recruit. There's multiple things we need to do, and it's just not one thing that's going to work. Ads don't just bring in the patients at our site. It might work for a lot of sites, but not my site.
Do you think because of your location? Because one of the things in Yuma, I've never had an easier time. We've been in the same industry, basically the same number of years. We're the same age, basically. But I've moved from a site, like I had like a 5-year stint here in Anaheim. Then I did Norwalk, Irvine, San Bernardino, and now Yuma.
Right.
But you've been in one place.
Right.
From all those places, I've never had an easier time getting studies.
Right. So getting studies is not the hard part. Getting participants for the specific studies you work on is the harder part. And then depending what condition you work on, psychiatry, CNS, are very challenging protocols. Now we have this other blood draw study that is extremely easy and we get a ton of patients, but then you go to like a psych CNS protocol. It's different. So it just depends on the condition you're working on.
Yeah.
We're also in a community where most people are research naive. Most providers are research naive. They don't work in research. They never had been exposed to it. So they're not talking to their patients about it. they're not talking to their patients. These patients are not going to participate in a research study. They trust these providers. They trust their doctors. If the doctor is recommending, hey, maybe you should look into this trial. Maybe this could be an option for you. They're going to do it. But so that's the challenge we're having. When I say we're educating the community, we're educating the providers as well, not just patients. We're getting to providers. We're seeing what we could do at their office. They might not want to be PIs or sub-Is, but they might want to refer patients. So how do we set that up in their office to make it as easy as possible? And that's where we're at right now.
So just for context, I want to come back to that, but just for context, Judy and I's sites are maybe an hour apart. I'm just a little further east in Arizona. She's basically in the same region.
Right.
Some of our employees like also applied to your site in the past. Like, it's a small community.
Yeah.
Do you think, because Latinos in clinical research, so everybody wants the Hispanic participant,
right,
with DE&I initiatives.
Mm-hmm.
Do you think we caught a good wave? Like, we're lucky. That's why it's easier for us to get studies, because some of our clients don't have as easy of a time getting studies in other parts of the country. I
don't want to say it's easier. I think we're in a community where there's not a lot of competition. We're very experienced in what we do. We've been around. My PI has been in the industry for a long time. So our reputation speaks for ourselves. We are able to recruit. We are able to perform. We are able to find these patients. So that's why we have these relationships with the sponsors, CROs, and they're coming back to us with other studies.
But they love the Hispanic participant.
And that's on top of it. We're in a Hispanic community. We're my office 15 minutes from the border.
Yeah, yours is like 80. Mine's like 60-40. Yours is like 80.
No, ours is like 75-80%. All my staff is bilingual. We we recruit English, Spanish speaking patients. We do rating scales in Spanish. We consent in Spanish. Where
do you still do the rating?
Yeah, I don't anymore. But I could.
I still do. I'm doing them right ratings?
Now. No, I don't because of my time. But now I've grown my staff and expertise on my staff that we have multiple raters now. We have patients that come from Mexicali. It's very common when you live in a border town that people work in the U.S. They might live across the border because it's just the cost of living is less expensive. Or vice versa. People, somehow work over there, but they live over here. So people go back and forth. That is what it is. And a lot of our patients are from Mexicali.
You get very passionate about the diversity and especially Hispanics, because that's what's in our community. And the sponsors, I don't call it virtue signaling because I think they're trying, but the efforts may be there, but the outcome is not we're not as empowered to recruit Spanish speaking the same as English speaking for a number of reasons. Maybe the ICFs are delayed.
Right.
The ePros are not translated. I've had some studies tell me, no, all patients need to be English speaking. And you're really passionate about this.
Yes, because I think what it comes down to is that we have these medications on the market. And most of the people that participate in these studies were Caucasian, very few minorities. And we don't know if they actually work. I don't know if these medications work on me or the rest of my family members who have these conditions. So then we see these medications get FDA approved. And then guess what? The pharma reps are coming to my community to push these medications when their data doesn't represent the patients in my community. That's an issue to me. That is why I'm passionate. I need my patients to participate. We need this data. This information is going to help the providers in my community to better treat these conditions, give them better medications. If there's options that they have to choose from and they know like these other medications work better on Latinos compared to these, then that's going to help them save time to treat those symptoms to help alleviate the pain, people are going through. And I think that's what we don't have with a medication, especially in psych CNS. It takes several weeks, several months to find the ideal medication for patients, and it doesn't always work. So you're saying this patient is going to suffer from like depression or bipolar or schizophrenia months and months until you find the ideal medication when there's so much more we can do. Like they shouldn't have to wait that long. And that's, I'm sure, with other conditions. So that's why I'm really passionate about that. We need people to understand that why it's important to participate. We need this information because guess what? These are medications you're probably going to be prescribed by your doctor. And if they're not working, it's because we didn't have that information.
Right. And this is where Latinos in clinical research comes in. When we had the idea, I was like, no, Judy has to be on this thing
Right.
as one of the founders.
Yeah, and then the other side of it is we have that gap, right? So we're passionate. We know we need that information, but then we have these sponsor CROs creating these protocols where they're excluding these patients because maybe scientifically behind the scenes, that's what it's ideal to have the perfect protocol. But then you're not getting that information you need, or you're creating these protocols and you only want English speaking patients.
You go to conferences way more than me. SaveOurSites.com. You get invited to like all these conferences, ACRP. You go to all of them. This year I'll go to ACRP. It's in Anaheim.
It's close.
Yeah, I'm gonna go. Do you know of any other site that is getting Hispanic patients?
The ones that are located in Hispanic communities. So, for example,
How
Miami.
many are there?
Well, example, Miami is a large, Hispanic community. So a lot of those sites do recruit Spanish-speaking patients.
Yeah.
Maybe there's specific areas, specific cities, maybe LA. I'm
Some
not too
in
familiar.
Texas.
Yeah, some in Texas for sure. But in order to recruit in those communities, specifically Latino communities, a lot of times does require you to have the Spanish materials because there are a lot of Spanish speakers that don't necessarily speak English or not enough to understand the consent. So that's why it's important.
And Hispanics are very skeptical.
Yeah. Yeah.
Especially Mexicans about.
Right. Which is why we need to continue to educate these communities, put the information out there, get to their doctors so they understand it a little bit better, which is kind of what we do in our community. We're throwing social media ads out there. What is placebo? What is a consent? English and Spanish. So people can start getting familiar with it. Eventually, over time, you start seeing something, then you start to pay attention. And that's why we're hoping, which we notice over the years. Then we get these calls where people seem to already understand research. So it's easier to talk about a study compared to years ago when we had
because they've been following your stuff.
They've been following, they've been reading. I've heard comments from people in Mexicali like, oh, I didn't know what this ADHD study was. And then I saw your ad and I told my friend about it because their kid has ADHD. I don't know if they're going to call, but at least I share that information. And that's what we want.
As far as running a site for 18 years, like, do you see anything for yourself beyond site ownership or?
Yeah, I think the past couple of years we've had all these opportunities to do so much more in the industry. So I would like to continue owning a site, running it, possibly have the opportunity to start other sites in other locations, but also do more in the industry, right? If it's educating more people with Latinos in clinical research and doing more in the industry, I want to do that. I think there's so many opportunities, so many things we can do. And I'm kind of open to different opportunities. I just don't know. I mean, there's so many things I want to do, right? Like it's hard. Like we're working with Latinos in clinical research. We have our site. We're doing SOS. So I have to be careful what I add on my plate because on top of it, I have 2 little kids, family life. It's hard to balance everything. But I only will take on what I know I can commit to. And then I won't agree to participate in something if I know I'm not going to be able to commit to it or give it that time it needs. And just take it year by year, whatever else I can add on, then take it on. But I think there's so much more that I want to do.
And the last thing, staff retention.
Oh, yes.
How are you doing? Pretty good.
Yeah, I think overall, we've had a lot of our staff for many years. I think there's a lot going on, in the industry, outside of the industry, a lot of personal things going on with people, especially with COVID, how things were before to after. So how do you keep your staff engaged? How do you keep them interested? In continuing to come to work. When you just work in one therapeutic condition, it does get tiring, maybe gets where you're overwhelmed. So then we're trying to grow into a multi-specialty research where we can bring different opportunities, different conditions, maybe just transition a little bit more to what we were doing to maybe easier studies because psych CNS are a lot of work.
Psych CNS is a lot of work.
They're time consuming.
And you've been doing it for 18 years.
Yes, and they require a lot of people. So I think sometimes you start to see your staff as like, okay, all these trainings they got to do and all these things they got to keep up. Can we make it a little easier for them? Maybe pique their interest in a different condition and they'll be more motivated. Internally, you got to also appreciate your employees, celebrate their birthdays, you're
famous for this.
annual retreats that we do.
Annual retreat. You go to Mexico usually.
Yeah, we have a really good relationship with the private practice staff. So we share the office in a sense, even though we're 2 separate companies, but we do a lot of things together. It's an annual retreat we do for the staff. For everyone. If you've been there like 6 months or longer, we'll try to do a local get together if we can. We do like birthday quarterly lunches. So whoever's birthday was in that quarter will go out to eat for their birthday.
Oh, everyone goes out.
Yeah, everybody goes out.
That's
and then we do we celebrate the birthdays internally. We, decorate their desks. We
You go to
flowers.
Inferno or where?
No, we'll let them pick. We'll let them
Oh,
pick.
you let them pick?
We let them pick.
Alright.
Like whoever their birthday is, like where do you guys want to go eat? So things like that, they make a
Nothing's
difference.
off limits.
No, well, there's only so many choices in America. You can't go, you only have so many spots. So we try to do a little bit more of that. I think that's what keeps them engaged and wanting to continue working there, right?
My clinic's similar setup with the private practice and us. We have a good relationship too. We're only 2 years, 2.5 almost. I'm already, I don't know if our PI watches, but I told him I'll never steal your staff, basically. But it's hard. I was going to ask you because a lot of times their staff look at us.
Yeah.
And they're like, what do you do? How do I do that?
Right.
And I'm like, look, I can't hire you.
Mm-hmm.
Do you have like rules like this? Or?
Yeah, that's difficult because I think it's the same way. Like we are doing all these things and then we know what they do. They kind of see and then maybe there is an interest there. You can't hold anyone back from wanting to do more.
Right.
But what I usually recommend if this comes up with an employee from the private clinic is that they talk to their office manager. Yeah. They talk to the physician, be like, hey, I'm very interested in going into research. Is there
It's dangerous for them though.
It's dangerous. But it's you can't hold them back. No. If they want to if they're not going to go work with you, they might go work. I don't know. Research might as well work with you. Right.
I'm sure if we deal with these things, other sites watching also.
Yeah. Yeah. I mean, it's not uncommon.
Nothing
that's
new under the sun.
It's not uncommon that you want like the staff to, and it might be easier to train them because they've already kind of seen what you're doing. So they might turn out great.
Interesting. All right. Where do you hope the industry is like a decade from now?
Oh man.
DCT, you think DCT is like gonna take over?
No. I think there's components of it that are useful that could work for some sites, some studies. It doesn't work for every single condition. It doesn't work for every phase therapeutic study that we're working on. But I think there are components. I think there's a lot of things we need to fix that aren't working necessarily. Some of these diary, electronic stuff. Some of these radar tablet things, we're still getting a lot of glitches. I'm sure that'll improve over time, but there's component. I don't think 100%.
You think CROs are still here in 10 years?
Possibly. I mean, they've been around since I think I've been in the industry.
You think they're as important in 10 years?
I don't know. It depends because what I've noticed is some sponsors are taking back their studies. Yeah. I don't know if you noticed
Tech enables that.
Yeah. Yeah, maybe. But yeah, and I think they're just kind of like not happy with some of these CROs and the way they're managing. I don't know. Yeah. So I do hope that all these conversations we've had about the things we're not happy with in the industry, we don't have these conversations. That's going to be something in the past. Like, remember when we used to talk about that? I hope so. But if I can go back to think 18 years ago when I started to now, a lot of things have changed. Yeah. Not a lot at the same time. Does that make sense? Like slowly, like it's, I think the most significant changes is back in the day when I started, we were using paper CRFs, the 3 triplicate copy
paper
ones.
Me too.
You used to have to fax them with other companies. I don't know if you had to do that.
Our monitor came in FedEx.
Right. And then they keep like one copy at the site. Yeah. I remember I think that's significant. Like over time, then you go to paper and then now electronic.
Now it's e-source.
Which is, I guess, you start... remember all those boxes and binders you used to have? Oh, I'm so glad we got rid of that.
So do you think like 18 years ago, you had the route to go CRA or site owner? You think you would have been this passionate about all these things if you were a CRA?
No, probably not, because then I would have jumped into the industry like CRO and maybe I wouldn't have realized all these things that I could change or I could have contributed were happening because maybe I was at the CRO level.
You think you would have still been like on stage at ACRP or no?
Probably, but as a CRO sponsored perspective, I still would have probably gone because that was my thing. Like once I get tired of a position or I think I've done everything I can, I want to go to the next thing. So I'm sure I would have advanced. I don't know where I would be.
You think you picked the right one?
Yeah, I think so. Yeah, I don't regret it. And I think about it now. I don't think I could go work for a CRO.
I could not work for anyone.
Because I also
was going to be a CRA. And thank God I didn't,
Right.
even though it's tough sometimes. Like,
I think more because I like being I like being able to make decisions. I don't have to wait for like a ton of other people to get an answer. I have my own schedule. I'm a business owner, and I don't see, not that I wouldn't love working for a CRO. It's just working under somebody else's rules, right?
Yeah.
Like I think I don't see myself going anywhere where I have to like do that other than being my own boss.
me too. I think 18 years, probably only had like 4 years, maybe 5, where we lost money as a site, which that's what people don't talk about.
Right. And,
losing money.
And it's funny because I was talking to some of the others that co-founders that are here, is you have your ups and downs with a site, right? Sometimes you're doing really great. Sometimes you're not. You can have internal issues. You can have staffing issues, investigator issues, financial issues. And that's part of owning a business, but it's not that different than any other business, right? I think Chris was mentioning like the first 2 years, the percentage of businesses don't even last. I
It's like
forgot
80.
I think that's what he was saying. And then 5 years, if you make it to 5 years,
It's like 90.
exactly. Because there's a lot of things, running a site, financial is a huge part of it. A lot of people aren't very experienced in the financial aspect. And if you don't have a good grasp of that, you're not going to succeed, and you're not going to be able to be there for the long term. And I think from what I understand, a lot of these site owners go into the industry and maybe they're not that experienced in the financial aspect, how all this works. And so they don't last very long. But I think now there's a lot of resources to help you with that, so you don't experience that. It's just,
we had to learn from
me too. I had to like figure it out, or maybe there's a few in the industry I knew that I would reach out to. Over time, I figured it out. But now I'm like, oh my gosh, there's all these things that I wish would have existed back then.
Yeah.
But I had to figure it out on my own.
It's better. We had to figure it out on our own.
Right. Yeah.
I think.
You appreciate things better.
Yeah.
Yeah.
Plus, you figure out how to problem solve.
Exactly.
If everything's given to you, I mean, even these videos we do.
Right.
Well, yeah, you have a blueprint, but you didn't really think much for yourself.
Right. No, and I think anything that's thrown at us, we're like, all right, let's figure this out and move on from it, right? We're not going to get stuck there because of all this experience we've had over the 16 years.
It increases your confidence, I think.
Exactly. Like at this point, I'm like, whatever. Like good, bad, whatever happens throughout the week, let's figure it out and we're moving on. How do we make it better at our site, whatever else we're doing, right?
Well, Judy Galindo, guys, from Sun Valley Research Center. Her LinkedIn's underneath and in the show notes. Click it, connect. She's going to be at Save Our Sites. She should be on every panel, but she said, no, I only want to be on a few.
I mean, I'll step in. I'll give my feedback. Any questions anybody has, I'll be happy to answer.
We're on one together.
Yes.
Staff training. So we'll go in depth a little bit on that. But thanks for coming on, Judy.
Yeah, thanks for having me.
Like, subscribe, comment, share. Go follow her. Bye-bye.